Hemoglobin is important as it is an oxygen carrying capacity tool. Red blood cells contain hemoglobin. In the same way, white blood cells are fighter cells. Platelets help in control of bleeding and wound healing and bleeding disorder, and also in other bleeding aspects. Hemoglobin increase in white blood cells occur in many infections. In the same way, few infections cause decrease in white blood cells. White blood cells again contain neutrophils, lymphocytes, eosinophils, monocytes and basophils. Neutrophils mainly increase in bacterial infections, lymphocytes in viral infection. Hemoglobin helps us in carrying oxygen to various parts of the cells. In the same way, RBCs contain hemoglobin. So, increase in RBC counts we call it as polycythemia, whereas decrease in hemoglobin or RBC count we call it as anemia. Anemia could be due to iron deficiency, vitamin B12 deficiency or hemolysis. In hemolysis, the RBCs tend to get restricted due to various reasons. It may be due to various reasons. In the same way, WBC counts can increase in infections, inflammations as well as in blood cancers, which we call as leukemias. Low WBC count with precursor cells, where we tend to see precursor blasts from the bone marrow, are seen in leukemias. When the percentage of precursor cells or blasts increase in the peripheral smear, that is a routine blood test which we see under the microscope, there we get a hint that the patient might be suffering from cancer. So, high-end investigations like other flow cytometries and all are done to rule out or confirm the leukemia part. In the same way, platelets help the clot formation in the body. Whenever we have a cut wound or anything, platelets tend to aggregate at the site along with other clotting factors and fibrinogens. Platelets tend to seal the wound and help us in sealing the wound and help in stopping the bleeding. So, increased platelet counts is called thrombocytosis, which is not very safe in the same way, because the blood tend to get thicker and many blood clots tend to form in the body. In the same way, decreased platelet counts are seen in viral infections like dengue fevers and also in hemoparasitic infections like malaria. Decreased platelet counts can also be seen in leukemias, where the precursors increase. The bone marrow is completely full of the precursor cells, cancer cells, and they tend to decrease the RBC lineage and platelet lineage.